Hello, everyone. And as we start this foot and ankle trauma course, ankle fractures is something that you should know about because they are the most common fractures around the foot and ankle. And be it a foot and ankle surgeon, be it a general orthopedic surgeon, you will deal with ankle fractures day in and day out throughout your life as a in your career as an orthopedic surgeon. And you should know about ankle fractures in and out. You should know about how do you investigate these fractures, how do you manage them in terms of not just the initial management but also operative management. You should know how to classify these fractures as well, and then it is only when you know how these fractures are happening that you can manage them well. So ankle fracture classifications, although they are complicated, they are slightly difficult, but every orthopedic surgeon who is managing ankle fractures, which includes again every orthopedic surgeon, should know of the classifications. This is an important topic, and I expect you to go through this lecture in a lot of detail and see it with full concentration. So before we begin, I'll tell you that ankle fractures, like most orthopedic injuries, have a bimodal distribution. By bimodal, I mean that they have a peak at the age group of 15 to 25, and then they have another peak at the age group of 75 to 85. And what happens is that in males who have high velocity trauma, they have this peak, and this happens mostly in females who are osteoporotic. They tend to have these fractures later on in life. So that is how these fractures are in terms of demographics. In terms of location, most ankle fractures are unimalleolar or single malleolus. And of these single malleolus, lateral malleolus is again the most common type. Less or rather uncommonly, they can be medial malleolus isolated fractures. Very, very rarely, posterior malleolus may be fractured in isolation. These are called curbstone fractures. These are not very common and don't really remember it. Uh, Rare and less commonly, the fractures may be bimalleolar, and even less commonly, these fractures may be trimalleolar, involving all three malleoli. So, unlike pylon fractures, these fractures are twisting injuries. This is something that you should remember. Pylon fractures tend to happen within axial force. These happen with a rotational force. And that is how the classifications of these fractures is based. And the most useful and most common classification is the log-Hutchinson classification. I'll be discussing it in a large part of the lecture that follows in this particular talk. Another classification is the Dennis-Weber classification, which is based on the level of the fibular fracture, where a type A is an infrasyndesmotic fracture, a type B is a transsyndesmotic fracture, a type C is a fracture that is suprasyndesmotic, that is above the syndesmosis. So this is the anatomy of the ankle. In this animation, you can see that the distal end of the fibula forms the lateral malleolus. On the medial side, the distal tibia extends medially to form the medial malleolus. And on the back, there is the posterior malleolus, which is again uh, uh, basically an extension of the tibia posteriorly around the talus. And what this forms is something sort of a hinge joint. It is a synovial joint, which is the ankle joint, where it is basically a mortise, which is formed by the talus, formed between the fibula and the tibia, and the top of the, or rather the bottom of the tibia is called the plafond, and plafond is basically a roof, and it forms the roof of the ankle joint, which is basically in the form of a mortise. So this structure is the mortise of the ankle. And this anatomy is important to remember because you should realize that the fibula is at a slightly lower level as compared to the medial malleolus. And this anatomy is important for restoration as you learn about fixation of these fractures as well over the next few talks.